Posterolateral corner techniques of reconstruction by Murat, Bozkurt.
First of all, I would like to thank for your kind invitation for this great meeting, and then I will present you posterolateral corner techniques of reconstruction and the.
You can do acute reconstruction in the early phases if they don't swell too much, because what happens if after the swelling happens, they get a lot of fibrous tissue in the lateral side, and it's then very difficult to dissect out the perineal nerve, and you're at a higher risk of iatrogenic nerve injury and finding your anatomy. If you were able to operate them in the first day or two before they get swelling, you may be able to do a reconstruction. But then you have to make sure that you have the ability to bring that patient to the theatre, that you have the appropriate equipment to do that case, and that you can get the adequate amount of graft. So it is a rare case that you can do an early reconstruction. It's very rare that you can do an early reconstruction. You can do an early repair, but only on the lateral side, maybe occasionally on the medial side. And then the vast majority of these cases are delayed reconstruction for me. It'll be 3 months before I get them back, because they start to get stiff. You need to rehabilitate them. You need to get the stiffness gone away. I was explaining to Cameron, I'm doing a multi-ligament knee on the 9th of June. This is a guy who tore everything 3 months ago. We did everything as they said on the talk. He had a CT angiogram. He's had his perineal nerve assessed. He's had his MRI scans. Sometimes I will repeat the MRI scan because the first MRI scan can be difficult to interpret. I will repeat the MRI scan a couple of weeks later once a lot of the swelling has gone down, so I can see exactly what is going on with the ligaments. The first MRI scan, it was really difficult to tell what his lateral collateral ligament was doing. On the second MRI scan, it was very clear he had torn. So I repeated the scan to just be sure that I knew what I was talking about. And now I've scheduled him. I've sent him for intensive physiotherapy to get his range of motion back, and I plan to do him on the 9th of June.